Well, good afternoon, everyone. Thank you very much for joining this workshop today, whether you've joined us on the Zoom call or through Facebook. It's excellent to have so many people on this call. What we want to do today is complete a process that we started recently to try and determine what the research priorities are right now at this point in the COVID-19 outbreak. So we're keen to work with all of you to see what we can discuss today and really hear from you. So I'm going to try not to talk for too long. So a survey was developed back in March this year from that began from the WHO blueprint. And the aim of the original WHO blueprint was to, at that point in time, just determine exactly where research questions should be directed, and obviously then funders could work from that. The African Academy of Science wanted to make sure that those same priorities did apply in Africa, and they followed the blueprint and developed a survey to ask researchers based across Africa whether they thought these priorities applied to them. So two things have happened since that point, really. Obviously, we've moved on in the pandemic, and here we are in June with the pandemic still rolling through its evolution in different ways across the globe. And so it's important now to ask, have those priorities changed? And also, are those priorities globally applicable? And so what we have recently done, and this is a collaboration between the Global Health Network, UK CDR, who represent many funding bodies who fund research into global health questions, and the African Academy of Sciences, to redo that survey, building still on the WHO blueprints, to ask actually what questions need to be asked right now within this pandemic. So what I'm going to do as briefly as I can now is take you through the provisional findings from that survey. These are very much preliminary results, so I'm just going to present them very quickly and to give you an idea of what's come through. And whilst I'm talking, can you each on this call have a think about whether you agree with those priorities, if they are right for you where you're sitting and working right now. As I talk through them, think maybe what's not been covered at all. And of those things I talk through, what would you really like to emphasize? And I'm going to come back to this at the end. So what we really want to do today is hear from you. And this is a really important step in this process. We're going to write this all up as a report, and the outcomes from this workshop will really influence the findings, because this is an opportunity to discuss them and really see how much they reflect on your findings. So let me take you through them, and then we'll open this call up, and I hope lots of you take part. So we put the survey out, and the idea was to get as big a global response as we could, and we had 1,528 responses. And these were really representative across the globe, which is excellent. So any of you on the call who contributed to these data, we're very grateful, but we're quite delighted that there's a nice global picture from the evidence that we're about to show you. So I'm going to jump straight into the findings. When the WHO put their priorities together, these weren't ranked in any order. These were set out to show all the priorities, and they were put into different categories. So the categories I'm going to go through, and there's 8 of them, don't have a priority. It doesn't mean that drug trials are more important than natural history, say. These are just the order of the priorities. And so what I'm showing you now are the answers that came through from, we asked people to rank the top 3 priorities in this section immediately in the longer term. And you can see here the ones that have come through of being in the original WHO blueprint, and then the ones that were echoed by the African Academy of Sciences second survey. And so the first section we're going to talk through is virus, natural history, transmission and diagnostics. The immediate response that came through from this new survey was to work for better field antigen tests to detect virus, support diagnostics to improve clinical processes, and will work to support faster, cheaper antibody tests to determine exposure. In the longer term, we can see this change slightly. the diagnostics to improve clinical process, and then we want to have antigen tests, and finally a new one coming in for the longer term to look at the characterization of immunity and what that looks like in the longer term. So this is what our new survey are showing us, are those ranked immediate and longer term research priorities. So if you move now to the next topic, which is animal environment research, so we're looking at virus origins, management, and human-animal interface. These priorities were the same across immediately in the longer term, and they are about improving the socioeconomic behavioural risk factors and that spillover between transmitting between humans and animals, identifying the animal source of the transmission, and what that route of transmission would be, and then design and test suitable risk reduction strategies for animal and human behaviour. So they're nice and compliant with the original priorities. Shifting to epidemiology now. Now this is the first one where I'm going to show you this yellow box, and I just want to highlight this because this is new things that have come out in this new survey at this point. And so the top boxes in blue show the WHO and African Academy findings. The yellow box are new areas that have come in from this survey. So looking in epidemiology, broad agreement, immediate and longer term, that the priority is to describe transmission dynamics of the virus and understand how this is spread nationally, regionally and globally. Then immediately we come down to looking at disease severity and who is susceptible and who are the high risk groups. Finally, the need to do rapid cross-sectional surveys to look at the extent of virus transmission. In the longer term, we need cohorts to look at longitudinal lab clinical outcome data, and then to describe the severity of the disease, to look in that who are going to become most severely infected. So a bit of a switch around there between the short and longer term. So interestingly, these are our first new findings that have come through. Immediately, there's a call to look at the relationships between other co-infections, and longer term to look at the complications and impacts of children and children with comorbidities. Moving now to clinical management, we can see the immediate priorities are to obviously look at interventions that improve clinical outcomes, to determine clinical practice strategies, and how we look at early diagnosis, when to discharge, when to use therapies and so on. Then developing management for severe disease, but in the long term we want to look more at the natural history of the disease, and look at carefully standardised case descriptions, understanding more in next about these clinical outcomes, and then looking at the so we're really swapping 2 and 3 for the longer term in that priority ranking. And again, we now have some new priorities coming through here, looking at clinical guidelines for post-hospitalisation management and community rehab. We had quite a few calls come through about looking at the impact on pregnant women, and then looking at this long-term ability to look at the management and prevalence of other infections. And this is coming out as looking at both how comorbidity and co-infections impacts somebody having COVID as well, but also the impact of management in the healthcare setting of other diseases and how that's impacted by coronavirus also being present in the health system. Moving on to infection prevention and control, including looking at health worker protection and PPE, immediate, clear and long-term goal is to understand the effectiveness of some of these public health movement control strategies that prevent secondary transmission, and I'm sure we're going to talk about that more later as well. Switching around to the second and third priorities, looking at effectiveness of PPE in reducing transmission and looking at new approaches to PPE. In the longer term, how do we support health systems post-outbreak, and then back to looking at the effectiveness of PPE coming in there. Moving on to evaluating potential therapeutic interventions, immediate responses haven't changed, but this is how they come out between now in the priorities and looking between both sets of findings. the immediate need is still there to develop mechanisms to support collaboration for the implementation of clinical trials. So I think that's really interesting, calling that out to say that we need this coordinated approach. We still need basic science to identify new drug targets, and then looking at existing candidates for clinical trials. In the longer term, the emphasis is pushed up to looking at that basic science, still calling out for supported coordination trials. And interestingly, the third priority for the longer term is to develop multi-centre master protocols. Moving on to vaccine R&D, just to flag out that we've got a new priority coming through here. The immediate priority is to develop a master protocol, so this does seem to make sense with where we are in the epidemic. Capacity development for doing both basic science and preclinical development of the vaccines, and then identification of candidates for vaccine evaluation. In the longer term, that capacity development comes through again, along with the master protocol and identification of new candidates for consideration. And the new one that's coming through is looking at new vaccine delivery modalities, which I think as a global perspective, that's a really interesting new one to come through there. Moving on to ethics, one shared key priority goal is to identify knowledge gaps and research priorities in relation to ethical issues that come from using the restrictive public health measures that are in place across the world. Secondly, to look at governance frameworks for effective collaboration between all the stakeholders involved. And then we've got different ones with third priorities, which is immediately speeding up the process for ethics review of research protocols, which makes sense. And then the longer term, to have sustained education, access and capability building to implement cross-working and collaboration across the different research themes. New priority coming through from this survey has been an ethical consideration of how resources are allocated in low middle income countries. And then another one about whether it's ethical to recruit final year medical and nursing students during the pandemic. So moving on to social sciences in the outbreak, the immediate call there is to investigate ways to ensure transparency of information flow and mitigate false information. Secondary to that is to look at the knowledge produced is according to local, national and regional needs. And then the third shared priority is to look at optimising communication about potential intervention, especially in high dense, low socioeconomic urban settings. And then for the longer term, the priority is to ensure knowledge produced it works to local, national, regional needs. And then that call to promote knowledge according to the timing of the epidemic. So maybe that's come through now because of where we are in the pandemic. New priorities that have come through from this survey are an immediate one of understanding COVID-19 in the context of difficult situations such as conflict, war, refugee situations, and in the longer term to look at how effective is social distancing in public spaces and look at the behaviour and perceptions around those. So they were a quick gallop through some of the findings that it came through, and that those were the ones that matched precisely to the original WHO blueprint. I'm just quickly going to give you some further new priority areas that came through that we couldn't assign to those original priorities, and so these are really important just to call out in a separate way like this. So we heard that there's interest in doing research onto the environmental impact of the response to COVID. And so that's looking at air pollution and carbon dioxide emissions, for example, and the environmental effects of all the disinfectant and hand sanitizers that have been used, and of large-scale PPE production and disposal. And then preparing for the next pandemic, looking at measures including community surveillance, emerging zoonotic diseases and screening, and to put in place international cooperative ethical body that can rapidly approve protocols for the next pandemic. And then an evaluation of government policies and lessons learned, again, to prepare for the next one. So this is the big change, I suppose, which makes sense from the early blueprint work to begin to look forward now as well. And so lastly, these priority questions came through as well, which we couldn't put into any of the original themes. Investigating the possibility of reinfection recurrence, the role of companion animals in disease transmission to humans, the relationship between repeated viral exposure and disease severity, so especially for frontline health workers, the importance of vitamin D levels, and using cross-cutting technologies across various aspects. This came through. This is preliminary data, as I said. We just tried to put these last topics in. These came up several times, and we've just grouped them into these sentences. But these last 2 slides are the new things that have come through outside of the themes from the original survey. So I'm going to try and stop talking now, because we have a great collection of people on this call, and the whole purpose of today is to take within this hour for you to tell us if you agree that with these research priorities I've just read out, but you don't need to, it's not a test to see if you remember them all, because actually we want to step back and say to you, if you were going to do a piece of research now, if a funding body was going to give you a pot of money to do some research today, what would you want that message, that research project to be? How would you use that money, and what question would you ask? So we're just going to open up the discussion now, and I'm going to invite people who have put some messages on the chat about what they think the research priorities would be. And it would be great if you want to comment on what I've taken us through so far. Did we miss anything? Is there anything you'd like to emphasize? But what I'd like all of you to do is to think about, what research question would you do now if you could do absolutely any piece of research within this important window of the pandemic? So we've got a great list of people on this call, and I'm going to ask you all to have a look on the control panel at the top, and if you look at the button that says more, it should show there's a little 9 in red, and that shows the chat function, and you can write in there your question, and then we can give you the mic, and then you can speak. We won't get through everybody today in this call, but that doesn't matter, because we will keep and record everything everybody has written in chat. If you're watching this on Facebook, you can still message in, and we will still use your comments. So for those joining us on Facebook, you're just as important as everybody else, and we're all in this together, and we really want to hear from you. So whilst you're all thinking about this, I'm going to turn to some of the people that have come forward to make a comment. I'd like to start with Marian Hassan. Please, could you introduce yourself and tell us your thoughts on what you think the research priorities are right now in this pandemic? Over to you, Marianne.
Thank you, Professor Trudy. These were very interesting findings, and I'm really happy that the WHO blueprint map has been reevaluated in a sense through this survey as well. I'm a physician researcher and a research administrator at a cancer treatment and research center, which is also currently fighting on the COVID front. I'll just jump on to my comments, not to take up too much time. I think I'll start with some points that we all know, but it's important to remind ourselves about the context within which we are right now, because research operates in a certain context. So there's a global context of a pandemic. We are all aware of that. But then, because I come from a lower middle income country, which is Pakistan, I think I'll focus more on the context of an LMIC country such as ours. So in the current pandemic, because research, especially biomedical research, depends a lot on the context of the healthcare infrastructure of that region. And lower middle income countries already, they have fractured healthcare infrastructure at best, which is further taxed in a pandemic such as this one. And then there are certain social and economic realities of LMICs also. most of the containment efforts that even the developed world is struggling with, purely because of economic reasons, are of an even graver concern for us, because indefinite lockdowns are certainly not an option for us. They are not for anyone else either, but they become even more difficult for LMIC countries. And then there's a socio-historical context also. Um, in many countries, at least in South Asia and Africa, there has been, there's low literacy, there is poverty, and then there is also, a historical context which leads these population to mistrust anything global that affects them. And this mistrust, I think, has become the core problem everywhere, and this is more so for countries like us. So within this context, I completely agree that it's very important to focus on therapeutics and vaccines, but it seems that if we will not take social sciences and behavioral research alongside the biomedical model of research as a matter of urgency, we will not be able to benefit from the evidence that is emerging from biomedical research when that emerges. And we are all aware that recently there has been a lot of discussion in the literature on the integrity of that research also. Because the knee-jerk reaction globally has been to fast-track everything, which has led to an exponential growth of evidence that is coming to us at left, right, and center. But we have already started seeing that that evidence is not necessarily robust in every case. So it's, and this leads to further erosion of public trust. So it's extremely important that public awareness, education, and trust is explored, and ways are discovered on how we can change that, and that we find effective ways of community engagement to change the public's knowledge. And when I use the word public, I don't just use this for the layperson. I use this for health care workers as well, because there's as much misinformation amongst them. And I think that we need to find ways of robust communication with healthcare workers as well. There is a sense of physical, mental, and moral burnout amongst healthcare workers, which is also emerging to be an emergency of sorts. So, so I think that the bottom line is that funders should fund studies or maybe prioritize studies that are large scale, collaborative, that incorporate social sciences and behavioral research and community engagement alongside testing biomedical interventions, including vaccines. And that most importantly for LMICs also focus on capacity building and post-trial access. Because the dream of realizing the benefits of research start after the research is over, and it does not materialize for LMICs often. And I would like to just end on one point, that we cannot forget global health in this pandemic, because the other infectious illnesses and NCDs, which are currently being ignored, are the next looming crisis for us. We are a cancer hospital, and we have had to fight on two fronts. That is both, allocating a fraction of our resources for COVID management, and then also continuing with cancer patients management. And you can imagine that cancer patients are a immunocompromised population, and we are a charity hospital. So this has been really difficult. So it's really important that global health is not forgotten while we handle COVID. And I would end with one final point on the importance of generating leadership, research leadership in LMICs, because without that, the status of healthcare access for LMICs would not change.
Thanks, Mariam. That's brilliant. Thank you very much. That's really eloquently put. We've got lots of comments coming in, so that's fantastic. If everybody can find the chat function, and I really want everybody on the call to tell us what their research priority question would be. And so I'm going to pass now to Matilda, who has to, who I know wants to talk about the research priorities that they've been discussing in Malawi. So over to you, Matilda.
Yeah, thank you very much, Professor Liang. So Matilda, I work for the organization called Agency for Scientific Research and Training. We are based in Liang in Malawi. Our key partners are government departments and various local partners and international partners. All of them are responding to the COVID pandemic. I was privileged yesterday to attend a high-level meeting which was organized by the Minister of Health, calling together all their key partners within the country. By key partners, I mean academic institutions, NGOs, but also we have a number of international research organizations, for instance, the Johns Hopkins, University of North Carolina, and then we have the Liverpool Wellcome Trust, who have wonderful laboratories in Malawi. So the idea was to consolidate the WHO blueprint and focus on the Malawi priorities. So it was a very enlightening meeting, of course, but you can see that priorities really context focused, because every country, as would expect, would have its own impinging factors. Take, for example, in the case of Malawi, we had an issue whereby we had a lot of people who were working based in South Africa, and these had to be sent back home because of the conditions of lack of jobs, so they need to feed and maintain themselves. So the only answer for them is going back home, but they have been all along based in South Africa for many years. Now, in coming back to Malawi, we looked at the challenges of how to manage these people who were repatriated back to Malawi. So there are a lot of factors there that you look at how difficult it is for the government to implement these public health interventions. That's just one example. And then the other issue is that every country has a
Okay, we've lost Matilda there. We shall hopefully come back to her in a minute if she's had a connection problem. You're back, Matilda. Carry on, go ahead.
Yeah. So all in all, my point is to look at how each country, these low-income countries, including Malawi, the focus will be what are the priorities? How can we make choices? Because those choices are also coming from an individual level. If the government announces a lockdown, at an individual level, the family has to decide, do I stay in a lockdown and starve, or do I still have to go out there? Then you have an issue of presidential general elections. Then the issue is that, do I trust the government when they say lockdown? Or they are saying this because they have an underlying agenda to stop me participating in the presidential election. So there are a number of issues that are really context focused, but also how difficult, as I say, it is to look at these public health interventions. But all in all, is focusing on the source of, what is the source of mistrust? How can we make effective communications when we are doing community engagements? But also, how do we enhance compliance? For example, in the issue of lockdown, but also in the issue of use of masks. If the government announces use of masks, when you go out in the public places, in the markets, in schools, if they happen to open schools, how do you ensure there's compliance to that? And then the lockdown, what is the support mechanism when you are implementing such type of intervention? So I just want to talk about those type of specific context challenges. The Malawi government, as I say in this meeting, did capture a snapshot of the key focus areas. Of course, very difficult to work in the Malawi setup in terms of looking at the biomedical research. but mainly the focus there is really social sciences and how we are responding this community engagement, and how the government is responding to that. So I've shared that, and I can also share some of that with my colleague if need be. But without having to take so much time, I think all in all. But in Malawi, it looks very positive because they have this national COVID response team. The committee which was meeting yesterday was a subcommittee of the research subcommittee of that national COVID response team. So creating a very good platform for collaboration, but also making sure that the government is having access to the data, to the evidence that is generated through research. So in short, that's what I wanted to share with you. Thank you.
That's great, and really, really helpful. There's lots of people who want to speak, so we're going to try and get through everybody, but honestly, it doesn't, if we don't get to everybody, comments on the chat are going to be counted just as much. So please do write your comments on the chat, and we were going to write all this up and share it as a report with everybody at the end. So I know lots of people are chipping in on the chat, so that's excellent. Keep that coming in. I'm now going to switch over to Myra to hand to you. Could you, if you're happy to share with us your comments, please, Myra. I think we'll just need to, Myra, I think you might be muted still. Okay, if we can't get to Myra, then I'm going to jump straight to Jacob from Kenya, who would like to make a point. So over to you, Jacob, and then we'll try and come back to Myra next, if that's okay. If we can give Jacob the mic.
Hello.
Go ahead.
Oh, good. Thank you. I'm so grateful to be part of this discussion. I want to apologize that I joined a little late and I didn't get the full discussion. The question is very, very important, and I'm giving a personal opinion. And I think that, the low and middle income countries, they have multiple problems. And it will be very important for us to be looking at a holistic approach rather than a solution to a single problem. Otherwise, we will be coming back to each problem each time. Some years ago, we were focusing on Ebola. This 2020 is COVID-19. And in the years to come, we might have other problems. We are still dealing with antibiotic resistance, which is a huge problem, healthcare associated infections, and so on and so forth. So looking at all of this problem, what is the problem? The problem in low and middle income countries is poor infection prevention and WASH. And therefore, if we have to solve this problem, not looking at coronavirus alone, then our priority should be to improve IPC WASH in low and middle income countries. And therefore, my own opinion is that we should be able to at least look for ways to promote infection prevention and WASH in low and middle income countries. And then for the long term, then we could be focusing on vaccines. One of the things, my own opinion is that at this moment, when we are dealing with so many people that are dying in so many places, at least if we spend our time looking for vaccine, I'm sure by the time we will get the vaccines, I am sure many. Okay,
I think we've just lost Jacob there, but that was a great point about needing to do research into to hygiene practices and infection control. I'm going to see if I can jump to Wailili next, and then we've got a few more people lining up. So Wailili, are you happy to go next?
Yes, Trudy. Thank you very much, Professor Liang. So most of the points that are really critical to raise have been raised in the chat and with the previous speakers, as well as through your presentation. And it just came to me through the presentation that we really need to go back to the drawing board with our approach to this pandemic, or this one and future other emerging pandemics that may come out, and really go back to our sustainable development goals, the impact of not just the pandemic itself, but the measures that we are currently putting in place, the public health measures that we are currently putting in place, the impact of them on countries meeting our SDGs that we had put forward in 2015. And this applies across the board for developing and developed countries, where we were aiming to end poverty, to end hunger, to ensure quality education, for gender equality. We're now moving backwards with some of the measures that we have put in place, particularly with lockdown containment. So we are running the risk of moving backwards a decade or even more when it comes to achieving the goals of our UN SDG goals. So that, as well as the knock-on effect of these public health measures on service delivery, and service delivery within the health sector, but also, as equally importantly, outside of the health sector. Education is being affected, supply chains are being majorly affected across the globe. So we really, together with implementing biomedical or future biomedical measures, the public health measures we are putting in place really do need a little bit more of a thought-through process. They were fine for containment at a time when we had nothing else, but since we have been able to buy ourselves some time, let's look at the impacts, let's evaluate the impacts of these measures and how best we can continue moving forward whilst also not increasing transmission across those who are most vulnerable. But I come back again to our SDGs. Let's try to keep our SDGs at the core of the business of responding to the pandemic. Thank you.
Thanks, Holly. That was really well put. Excellent. So I'm just switching now to ask whether Christine wants to speak. Christine, I think you want to talk about public health systems. Could you introduce yourself and where you come from, and then tell us what your research priority would be? Thank you.
Hi, so good evening to everybody. My name is Christine. I'm from the Philippines. I worked in the academe for quite some time before transitioning actually into the private sector, where I work in investments and trade and policy. So it was quite a change for me. But during this pandemic and being at the intersection of health, trade, and policy, it was very interesting to see the different approaches that governments across the globe have taken to quell the pandemic in terms of the public health side and also in the economic side. And I thought it would be interesting to see whether these largely, we can't deny it's geopolitical decisions, have had an impact on the outcomes of patients in these countries, and create a sort of framework should another pandemic come that, other countries might be able to use, that countries might be able to use to guide their decisions better. Being a public official or someone who handles policy at this time, I can't even imagine the burden on their shoulders, having to make such wide-ranging and highly impactful decisions with not a lot of evidence. And so it would be interesting to see how the experiments in lower middle income countries and in developed countries have gone, whether social distancing actually works, and how much that actually impacts the outcomes of patients. I think a study to that effect, or a study of those effects rather, would be massively useful, not just for health policymakers or people in global health, but actually for global leaders as well. So I would love to see a study of that kind be made somewhere.
Wonderful, thank you. That's really well put. Now we've got lots of you who've written comments in and say you want to speak. So we can give you the mic. You need to find the raise your hand button. Abbas, we'd love to come to you. So if you can try and find that, that would be great. Whilst we are waiting for Abbas to come through, can I see if Myra's back online? Because I know she's got a point she wants to make. So Myra, are you able to, is your connection better now? The challenges of working on these systems. It's wonderful. We're connected around the globe, but technology lets us down sometimes. Myra, how there we are. Excellent. Over to you.
I'm with Christine. I'm from the Philippines also, but I see through the lens of epidemiology. We really need to harness our data, improve our data when it comes to that, as well as since we are working on the environmental and occupational health area, I need to see the social aspects or social behavior of people on the use of masks, since we have observed that not all Filipinos have been following through that kind of norm, as well as the use of PPE and how they disposed it. So I think that's all for now.
That's great, thank you, and really great to have you both on here from the Philippines. Okay, I think we've worked out we can have Abbas next. So over to you, Abbas. Go ahead, Abbas. You have the mic. So that's Abbas Abel Azaku. If I got the wrong part of your name, sorry. Hopefully you should be able to speak now. Go ahead. Otherwise, what we'll do, we'll try again with you, with the team behind the scenes. Whilst we're waiting to give Abbas the mic again, can I please jump to, we have Festus from Kenya, it would be good to hear from you, Festus, if you'd like to speak, if you're ready to speak now.
Yeah, I will speak now. Hello.
Go ahead, we can hear you loud and clear.
Yes, so based on the pandemic and in the aspect of low and middle income countries, I know we don't have much of the capacity to respond like the developed countries. And at the core of our interventions, we will think much on public health interventions, and this will include awareness because of the mistrust and fading confidence that communities have on about COVID-19 and how the government and different agencies are handling the cases. Other areas that we also need to check on are especially within the healthcare workers. It's basically the public health interventions. I've seen some charts on the chart about how effective are the PPP working on healthcare workers. Does it reduce the infections, or does the rate of infection still increase? So, but the main areas that I think we also discussed in earlier meetings were how do we implement these public health interventions that are key to containing the COVID-19 spread among the communities. And so we just need to come up with research questions that we are able to evaluate and quantify at the end of the implementations or the process of the research. And then we need to see how can we instill public confidence to trust that the public health interventions that the various governments, organizations, and NGOs are doing are actually going to curb or reduce the rates of infections and even admission, hospitalizations, and so forth. So for me, for the African setup, the most important intervention will be public health awareness and instilling confidence that whatever the government and various ministries are doing are going to work out in controlling this pandemic. Even I also seen on the research priorities the blueprint that antigen test kits that can be used within the field are research priorities, and I think this will work very well for a context in the African setting where we don't have much resources to buy reagents and equipments for testing. So this can be very helpful also for surveillance purposes, and then later they can be tested and approved for use during field activities to pick out COVID-19 cases. So basically, those are my points, and I think public health interventions are very key in prevention, whether lockdown, quarantine, isolation, and all hand washing that we are currently implementing in various countries. Thank you.
Festus, thank you. That was really well put. So we can now go back to Abbas, who's having connection problems, but we would love to hear from you, Abbas, if you're able to talk now. I think we've just given you the mic. Let's just, I think we can hear you, Abbas. I can hear some noise on the line, so do go ahead. Not to worry, we can come back and try again. Just while we're trying to get you, we have Adejumoke, who would like to speak next. If we can give you the mic now. There you go.
Okay.
Go ahead. Yes, we can hear you. Go ahead. Thank you.
Okay, thank you. I'm Adejumoke from Nigeria. I'm a pediatrician, neonatologist, and also an epidemiologist. I have some concerns majorly on the effect of this pandemic on maternal and newborn, as well as child health. I know this is global, but the effect is so much in the low and middle income countries. So I am of the opinion that this is actually underestimated. We need to be able to document the impact of this pandemic on MNCH outcomes, particularly for the period of the lockdown, and even also particularly in the aspect of immunization and maternal and child death, maternal and newborn death. This is very, very crucial. The number of mothers, babies, and children that have died far outweigh death from COVID-19. And this, nobody is thinking about it. A lot of children have missed vaccines. Nigeria has been declared as polio-free. But what happens after this pandemic? Are we going to record polio? Measles vaccine, how will it be? And other vaccines. Are we going to go back 50 years behind after COVID? We need to be able to document the impact of COVID. The other major area that I think we also need to look into, particularly as it relates to the outcome, the acceptability of use of isolation centers, use of treatment, and accepting results, is the behavioral aspect. A lot of people deny the result. Some will run away from the isolation center. Some will refuse treatment, and they go back to the communities and they start spreading. So we also need to find out what are the things that we can do that can actually promote. Are there other aspects we need to look into? How do we communicate results? Do we develop algorithm for communication of COVID results? So we need to be able to check all this. I'm also of the opinion that the issue of vaccine will probably take some time, but there are opportunities. If we make it open, I know we are trying to make it open, but we can do better. We can solicit for people that have local herbs, particularly in low and middle income countries. Drugs, some people are taking some of these drugs on their own. so we can solicit more for people to come out. Can we sort of attach benefit to people that will come out and tell us about their health, so that we can also look into potential drugs that we have antiviral properties? Not just the current ones that WHO is doing, but I think we should still continue to look for as a long-term plan. I will suggest that at the end of this meeting, we should divide our research priorities into at least maybe 2, but preferably into 3. We should have immediate ones, the ones that are more or less urgent that we need now. Then, of course, the middle one, and then the long-term plan. So these are my own comments. Thank you. Over to you.
That is a fantastic contribution, thank you. And that really echoed some of the things that came through the new priorities and some new ones there. We've probably only got time for 1 or 2 more comments now, but we've got loads of written comments coming through on Facebook and on Zoom. So please do keep writing those in. They will all be captured. They're all going to be reported, and they're all going to be contributing to the final sets of new priorities we're going to share with the funders. So please do keep writing in if we haven't heard from everybody. But what's great is that the contributions we have had are all really seem to sum up lots of the messages we're hearing. So I think we've probably got time for just 1 or 2 more. I'm just looking onto the screen. I think we're going to hear now from John. If that's okay with you. John, do go ahead and introduce yourself, and you've just got a couple of minutes if that's okay.
Yes, my name is John Hongo. I'm from Kenya, and my country pandemic is our priority should be focused on the community baseline studies, as we know that through pandemic there is a genesis for this disease, and if we overlook the community, I think we are going to miss the point, because we need first to go into the community or in the suburb area within the cities to empower first the community about the disease, because most important thing, we need to enlighten the community about the health issue, like how do they use water to clean their hands, how do they get access to hand sanitizer, how do they encourage them to use the face mask. So with all this, if we can focus on the community, because people down in the community may not be aware of the COVID-19, and as you may do some sample study within the low-income community, you may find some people are still not even aware of the COVID-19. So our research priority should focus on the community baseline studies. And also, we need also to incorporate the use of digital health technologies that will give a quick response, because every research, whatever we are doing, all involves about data. So without getting the quick response about what data speaks onto the community, I think we're gonna miss all these things. Thank you.
Wonderful. I think that was just such a nice final comment to end on, spoken here. We're going to wrap up on time, so I'm just going to ask all of you to take this opportunity to think carefully, and maybe this is calling out to everybody watching on Facebook as well, and we've put some social media around this, so if you're using social media, please can you share this as well. You'll be able to find us on Twitter and Facebook and LinkedIn for the Global Health Network, or for UK CDR or the African Academy of Sciences. what we want to know is if you are going to do a research study tomorrow, if the funders who are on this call, and there are many on this workshop now, we're going to give you a grant tomorrow, what is the question that you would address if you set up a study tomorrow? And we've had a whole raft of answers already, but please, everyone on the call, and share the social media request to this just to tell us what that would be. So I think what's been fantastic here is we've really experienced the shift from early in the outbreak, and we're beginning to understand the impact more, and it's been great to hear from so many countries today. I think what's come through very clearly, as far as I can see, is the need to shift from the research happening in hospitals and ITU to step back and do more research in the community, both to see what can be done early in infection to mitigate severe disease, but to understand what's happening in the community with those disease characterization studies. But very loud and clear, we've been hearing calls for doing research into the effectiveness of public health interventions, but also what the best way is to get public trust and get the right messages out there, and also understanding how we can minimize the wider impact on people not being able to access healthcare or the impact on healthcare. So these have all come through really strongly, both through the survey and then from the discussion today. So fantastic contribution, everybody, thank you. Last shout out, please share the social media links. We'll put them up on the screen and send them around to you all again now. But this is your chance to tell the funders what they should be putting those new grants towards right now. You know, within an epidemic and a pandemic like this, there's one window of opportunity to do this research, and it should be the right research, and the research should be equitable across the globe. Everybody should benefit. So I want to thank my colleagues from the African Academy of Sciences and from UK CDR for working with us on this. It's been incredibly useful, and we've had so many contributions. We will write all this up. It will be reports on the platform, probably within the hours. We usually get these up very quickly, and we will share these slides. This is an open process, and we value everybody taking part. So thank you very much, everybody, and for my team for helping today.